Good afternoon. My name is Viktor, and I'm a third-year medicine resident from the University of Alberta. On behalf of the lung transplant team, I would like to present our study titled Pre-Transplant Malignancy is Associated with an Increased Post-Transplant Malignancy Risk in Lung Transplant Recipients. Lung transplantation has benefited many patients with end-stage lung disease, although there are many complications as a result of this treatment. One notable example is the increased incidence of cancer occurrence, with up to 1 in 5 lung transplant recipients developing malignancy within 5 years of their transplant. The association between immunosuppression and increased incidence of cancer occurrence is well established in transplant literature. As a center that adheres to international guidelines regarding listing in pre-transplant malignancy, we assessed whether pre-transplant malignancy was associated with increased risk of developing any post-transplant malignancy in lung transplant recipients. Using data from our prospectively collected program database, we conducted a retrospective cohort study of adult patients who underwent lung transplantation between January 2006 and December 2017. The primary outcome was the development of post-transplant malignancy, which was further categorized into solid malignancy, cutaneous malignancy, PTLD, and leukemia. Multivariable Cox regression was used to test the association between pre-transplant and post-transplant malignancy. We adjusted these outcomes for known malignancy risk factors including age, sex, diagnosis, body mass index or BMI, smoking history over 20 pack years, and type of induction immunosuppression used. A total of 513 lung transplant recipients were analyzed. 28 of these patients had a history of pre-transplant malignancy. Baseline characteristics that were associated in patients with a history of pre-transplant malignancy include older age, a diagnosis of COPD or alpha-1 antitrypsin deficiency, and higher rates of smoking. 108 lung transplant recipients developed post-transplant malignancy, accumulating a total of 328 cancer diagnoses. Our univariate analysis found that a history of pre-transplant malignancy, older age, male sex, higher BMI at transplant, as well as prior diagnosis of COPD, alpha-1 antitrypsin deficiency, and pulmonary fibrosis were all associated with increased risk of post-transplant malignancy. Those with a history of pre-transplant malignancy had an adjusted hazard ratio of 3.26 for the development of all post-transplant malignancies. The adjusted hazard ratio increased to 4.71 for the development of solid malignancies and 3.54 for cutaneous malignancies. There were no associated pre-transplant characteristics that were significant in the development of post-transplant PTLD or leukemia. Based on our analysis, we conclude that lung transplant recipients with a history of pre-transplant malignancy were at least 3 times more likely to develop a post-transplant malignancy than patients without a history of malignancy. Due to the elevated risk, we recommend more vigilant cancer screening for lung transplant recipients with a prior history of pre-transplant malignancy. That concludes my presentation. Thank you for listening and have a great rest of your day.